in the Yale Child Study Center. And we are very honored to have him as our advisor in our post-graduation program. So he's a member, he's a supervisor of our program here in Brazil. And Professor Fernando Asbar, who is a member of our institution. He's a well-known child and adolescent psychiatrist here in Brazil and leads the program of anxiety disorders and child adolescent at our Institute of Psychiatry. We are honored by your presence and value and deeply appreciate your valuable contributions to this defense. So the name of the thesis is Family Accommodation and its Impact on Anxiety Disorders in Childhood and Adolescent Psychiatry. Pedro, the floor is yours. So Jim and Ellie, we start with Eli, and then we go to Fernando Asbar, and you close, okay, Jim? That's okay?
Hi, Jim. Hi, Ellie. It's great to see you. Thank you so much for being here, for agreeing to be here. It is an honor, really. And thanks everyone that is here. I see a lot of important people to me here. So thanks everyone for the time and the presence. And also, I am deeply thankful for my advisor, Professor Eurípedes. Thank you, Eury, for everything. And so, let's see. Are you guys seeing my screen, Ellie and Jim?
Not yet.
Not yet. All right. So, let's see. Share. And okay, I will share the entire screen. And yeah, so thanks for the international members of the committee. Thank you so much, Professor Fernando Asbar, a member of our institution that is here. And thanks, Eurípedes. Oh, onde Eury? Aqui. Foi? All right, so let's start. So yeah, the title of my thesis is Family Accommodation and its Impact on Anxiety Disorders in Childhood and Adolescence. Yeah, the pointer won't help me, but that's all right. Is it working now? Okay, I'll use the keyboard. So I'll start with some definitions. So the DSM defines anxiety disorders as characterized by excessive fear and anxiety. And it also differentiates fear and anxiety by the fact that fear is a response to imminent threat, while anxiety is an anticipation of a future threat. And I like this image here. To illustrate, here on the left we have a child and that is fearful of a spider, and the spider is there present in real time. And on the right we see an anxious child, just anxious of the anticipation of the possibility of bumping into a spider. Nonetheless, these two phenomena are highly connected, and they are both part of our threat response system. So here we have a basic representation of our threat response system being activated. The threat here in this case is a snake, and we see the human body, and we get to just get a glimpse of some things that are activated in this system. So we have the brain, we have the amygdala being activated, it communicates with our adrenal glands, we get an adrenaline rush, all the autonomic arousal symptoms, and ultimately we'll get the behavioral fight or flight response. This is what we call the interpersonal activation of anxiety. In small children and babies, it happens pretty much in the same way. We'll have the amygdala activation, we'll have the adrenaline response. However, the child cannot fight or flight. The baby won't be able to get up and start running away or fight the snake. So it relies on activating this system of the caregivers. So the typical response of a small child would be to start crying, screaming, and this would get the system activated in the caregiver, and then the caregiver would be able to execute the fight or flight response. And this is what we call the interpersonal activation of anxiety. That is extremely important when we are talking about childhood and adolescence anxiety. In this context, one very common set of caregiver behaviors is called family accommodation. And family accommodation refers to the changes that caregivers make to their own behavior in order to avoid or reduce their child's anxiety. I could present a huge table. The reference here is Ellie's book on breaking free of child anxiety and OCD, and he has plenty more, but it would be virtually infinite, the amount of symptoms that we could exemplify, and also of the accommodations that follow them. But I'll show these two. So here in the first row, we are exemplifying a social anxiety case, where the symptom is whenever a waiter comes to the table at the restaurant, the child looks away and does not answer the waiter. A family could accommodate this by, in this example, the parents always ordered for their child and answered any questions that the waiter would question. And in the generalized anxiety case, we have a child that worries every day that their homework is not perfect. And the parents here, they review the homework with the child every day, several times per day, to give reassurance to their child. So as you can see, family accommodation does bring short-term relief, and it relieves the child's anxiety. It also relieves the anxiety that the parents are feeling to see their anxious child. However, the problem is that, just taking this out of the way, in excess, family accommodation is associated with important negative outcomes. And here I highlight 3 of them. Excessive family accommodation is associated with higher child anxiety severity, worse response to treatment, and worse child impairment. And by whenever I click out of this slide, I lose control. All right. And by impairment, we are talking about difficulties in independent, age-expected functioning of daily life. One way to assess this is by this questionnaire called the CAIS, Child Anxiety Impact Scale, that assesses 3 main areas of the child's daily functioning, which is school functioning, social functioning, and family or home functioning. And here, just a couple of items of each area. So difficulties in completing assignments in class. The child can have difficulties doing homework. The child may have difficulties being with a group of strangers, eating in public, away from home or at a friend's house. And for the family home area, the child can have difficulty getting along with brothers or sisters or getting ready for bed at night. So now, we have another column in our table. And for the first one, we could see that item number 6, difficulty eating away from home, would be an impairment. Here, could be an impairment. And item number 5, difficulty in doing homework. In this case, it would be a functional impairment. So now I have touched on the main concepts that I wanted to introduce. I will go into the objectives of our studies and the methods. So this thesis is composed by 2 studies. One of them is a mediation analysis study in which we wanted to check if this link here between anxiety and functional impairment could be mediated by family accommodation. I hope it will be clearer when I talk about the methods. And in study 2, we employed network analysis to explore these 3 important phenomena that we also touched upon at the beginning of the intro. Parental anxiety, child anxiety, and family accommodation. So the methods, there's a big part that is shared between the 2 studies. The sample is basically the same. We just have a slightly higher sample for study 2. It consists of a little more than 400 pairs of children and their mothers who presented for evaluation for anxiety complaints at the Yale Child Study Center. And in order to be included in the study, they had to present a primary anxiety disorder diagnosis as ascertained by the anxiety disorders interview schedule. And it is important to note that assessments were made before starting any treatments. So this was not a factor here. For study 1, this was the structural equation model that we checked. To get here, it is easier if we go back to a basic mediation model. So every basic mediation model consists of this triangle here. We have one effect of child anxiety on functional impairment, and we are checking if family accommodation could be a mechanism driving this effect. It is different from moderation. So usually classes and courses talk about them in parallel, and it's easy to get confused. So when we're talking about mediation, we are investigating the how and why behind an effect. So there is an effect of A to C, and we are checking if A could go to B and then go to C. This could be a pathway. If mediation exists, then we could conclude that accommodation is one of the reasons why anxious children become more impaired. In moderation, we are investigating the when, for whom this effect exists. So when there's an effect of A to C, if moderation exists, then it depends on B. So in this case, if moderation exists, accommodation amplifies or reduces the effect of anxiety on impairment. I like to think of these 2 different things with these images. So here we are looking at mediation, the analysis. We are trying to find a cogwheel of the mechanism, one of the pathways, one of the pieces that could link these 2. This could be one of the cogwheels. And here, for moderation, we are trying to identify this is an amplifier knob. So could family accommodation amplify or reduce this effect here? Is it an amplifier knob? And we tested the moderation, and it was negative. So our focus, this is a finding of our study. We focused more on the mediation, but this is a finding, a relevant finding. But we actually, our mediation model was not only this basic one. We looked into child functional impairment as a latent variable being informed by the 3 subscales that I showed you. So the school's impairment subscale of the CAIS, the social impairment subscale of the CAIS, and the home family subscale. So we are getting there. We are getting almost there. Now we got there. We also added child age as a covariate in order to adjust the model for the children's age. And now we are done. We get the model. So this is how it was constructed. We tested 2 variants. So one of them where the child anxiety was being informed by the parent. So it was parent-rated scared. And the other one where it was informed by the children. So they were answering about their own anxiety. We also tested an alternative mediation model. So we replaced these 2 variables, and now we are asking the question, does the data support the model where functional impairment could mediate this effect here? And we also did that. So these were the strategies for study 1. It is important to note that study 1 is hypothesis-driven. It is a confirmatory study. We are specifying the model and testing it. Network analysis are always exploratory. They are data-driven models in which we don't assume the directions. We let the model indicate the most probable relationships between the variables. And for our network, we chose 7 variables. So we have the 5 anxiety dimensions of the SCARED questionnaire. And we chose 2 important parental variables, parental anxiety and family accommodation. And there are 2 ways that we can construct or estimate these networks, the undirected way and the directed way. The name helps in understanding. The directed network is also known as Bayesian network, and here directed means that the relationships we are trying to figure out what are the most probable direction between this relationship. So separation anxiety influencing social anxiety. If we make a relation to other methods, this is almost like a regression or several regressions. We are trying to identify which variables predict the other. And here in the undirected network, which is also called partial correlation network, we are estimating correlations. So when we think about correlations, we are not thinking about directions. We are saying that 2 variables are just proportionate to one another. So yeah, that's pretty much it. I'm not going to go into too much detail, but here are some methods behind these estimations. So here we have on the left a precision matrix. The precision matrix is the inverse of a correlation matrix, and then this is inputted into the graphical lasso algorithm that converts this into a visualization. And here on the right, we have a hill climbing algorithm that is used to estimate the Bayesian network. So we do 50 random starts with 100 perturbations each, and each perturbation is the addition, removal, or reversal. Don't worry too much about it. And we do this for 10,000 bootstrapped samples in order to reach the final estimated network. And these networks, they allow us to check different metrics, which are much easier when we are visualizing the results to understand. So I will go into the results sections to explain this part of the methods. So for study 1 results, here are the 2 networks that I showed you. On the left, parent-rated child anxiety, on the right, self-rated. These numbers are the direct effects, taking this out. And the really important thing here are not the direct effects. What we are indeed interested in is the indirect effect or the mediating effect. This is not something that is depicted on the picture. We have to ask, this is the, just to show the screen of the M+ and the specification of the indirect model that we are testing. And here in the indirect effect, we can see that this is indeed statistically significant, and also the estimation of the effect size, which is around 20% for the parent-rated child anxiety model, and 48% for the self-rated child anxiety model. And I showed you the alternative mediation model by changing the places of these two variables here, and this was not significant. So the data does not support this model. So now on to study 2. I'll just have a little sip. All right, so this is the undirected network. And this is a list of the metrics that we can check. So this will help us understanding this image. So the first one is edge weight. Edge weight refers to the strength of these connections. There are 3 ways. They are kind of redundant, but they help us easily see things. So variable distance here, it tells us if the connection is strong or weak. The saturation, so the darker the blue, the stronger the connection is, and the thicker the connection is, it also means it is stronger. So this is like a very thin connection. This is a thicker one. So I'll guide you through it. Separation anxiety and family accommodation. We can see that these variables are closer together. The edge here is pretty dark and thick. So we can guess that is one of the stronger relations. School anxiety and panic, somatic anxiety is also an important connection. And panic and generalized anxiety is also another important connection. And we also have a table. And if we look into the table, the 3 connections that we identified, these are indeed the stronger connections. So this is the strength of the network analysis. Lots of things are visual, and instead of going into numbers, we can see things. So we can also see how variables cluster together. And we got 2 clusters. So one of them where the child dimensions cluster together, except for separation anxiety. Separation anxiety, interestingly, clustered with the other parental variables. I will discuss this finding later. We also have these centrality measures. The centrality means the sum of all connections of a single variable. And one way to do when we have a multidimensional scaling network like this one, you can have this trick, which is to imagine the network in a plane. And if we try to balance it in our finger, we can guess that it's somewhere around here, the center of the network. And so just by visualizing, we could guess that panic, somatic, and generalized anxiety would be the most central variables. Then we would check on the graph, and indeed, panic and generalized anxiety are the most central variables. And we also have this, which is called bridge centrality, which refers to the sum of all connections of a variable with a different cluster. So just by looking, let me take this out. We can guess that these 4 maybe have connections that are strong with the other community, because you can see that the most peripheral ones are not having too many connections with the other community. But the graph really helps us in seeing this, and we can see that family accommodation actually presents the highest bridge centrality value. We're almost there. The 4th one is predictability, which we can also see. Predictability are these halos around the variables, and they tell us, they have the same meaning as the R squared for regressions. So they are showing us how much of the variance for that variable is being explained by the network. And we can see that some of them, and the most central ones, have higher predictability. Oops. So around 35, while the most peripheral ones around 14% of predictability. And we can also, the fifth and last thing, we can compare networks. It is not a very sensitive test, but we nonetheless compared the parent and child-rated anxiety networks, and there were no significant differences. And we also compared networks for these two subgroups, the younger and older children, and there were no significant differences. And the last image is the directed network. So the directed network, we have here, the connections, they are directed, they are arrows. They are showing the most probable dependencies. And one thing that we can see here, so we don't have colors like the undirected network, but the thickness also depicts strength of association. So you can see it is the same data, so they are the same connections between panic, somatic anxiety, and school-related anxiety, between panic, somatic anxiety, and generalized anxiety, and between separation anxiety and family accommodation. We can also check edge number, which is a related measure to centrality. So we can see which are the variables that have the most, the higher amount of connections. And here we also get the same ones: panic, somatic anxiety, generalized anxiety, and family accommodation with higher edge numbers. And we can also see which variables the model estimated to be the terminal ones. And here we get school-related anxiety and parental anxiety. So terminal variables, they have no outgoing arrows. They only have arrows that come to them. For the discussion, this is the main results of our study number 1. We conducted for the first time a structural equation modeling to check the mediation between these. It had been done with regressions, but with structural equation modeling was the first time. And what this enabled us was not only to check if it was significant, but also have an estimate of effect size, which had not been done before. And we believe this to be around 20 to 50%, somewhere between the two models that we tested, the self-rated and the parent-rated. For study 2, it is an exploratory study, so we have many findings. I highlighted 4 of them. So the first, generalized and panic somatic, played central roles in the network. This is consistent with the understanding that autonomic activation and general concern are common to all anxiety dimensions. And the upstream role of panic somatic anxiety is also consistent with the understanding that autonomic arousal responses in the body may serve as triggers for generalized and context-specific anxious cognitions. The second finding, that separation anxiety clustered with parental variables, this is consistent with previous findings from correlation and regression studies showing that separation shows a stronger association with parental variables. It is nice to check this in the network that controls for the effects of every other variable. And this may be due to the fact that separation anxiety is usually specifically targeted at the caregiver, the attachment figure. Other child anxiety dimensions are not so specific, so you can think that a child with social anxiety, they may be socially anxious around the parents, but this can also happen outside of home, in school, with friends, and so usually is not something so specifically targeted at the caregiver as separation anxiety. The third one, that school-related anxiety presented a terminal role. This is interesting because school-related anxiety is related to one of the worst negative outcomes in child anxiety, which is school absenteeism. And it is also interesting because terminal variables may indicate that multiple possible intervention targets are possible in order to avoid a terminal phenomena. And the fourth and last one is that family accommodation played a more influential role than parental anxiety. This is indicated by it having a more upstream role here in the directed network, and also having the highest bridge centrality value. And this is in line with the literature concerning parental involvement in treatment of child anxiety. So I borrowed this slide from Ellie and the SPACE workshop. So this is a review of some of the studies that were conducted investigating how involving the parents, if they helped or not in the treatment. And most of them actually were not able to show a statistically significant effect. And what has usually been done is training parents as lay CBT therapists, or just focusing on treating the parents' anxiety, or teaching parents generic parenting skills. And this is the illustration of a parent trying to apply all the CBT principles with their child, with their anxious child. So this may indicate that focusing on theory-driven interventions that target specific behaviors that are specific in the context of child anxiety, for example, family accommodation, which is a known one, may be one strategy that was lacking in standard treatment approaches. And here I highlight Ellie's study that showed that the SPACE program was non-inferior to CBT focused on the child. And our study, of course, had several limitations. One major one is that these were cross-sectional analysis, so they may indicate what the data supports, but it cannot establish causality. Another one is that parental data was reported by mothers, so it is interesting to think whether these results would change if fathers were also reporting on this data. And yeah, there are probably many other potential mediators or moderators that remain to be elucidated and tested. And the fact that the predictability in our network was modest, at most 35%, and this indicates that more complex models may explain a greater proportion of variance. However, having a simple model with some of the key variables that we are interested in the context also has some value. And this is it. This is my last slide. This is a depiction of my network, of my trajectory. And here you know this man here. And this is my advisor, Professor Eurípedes. And we did a mediation analysis. I'm pretty sure that the indirect effect would be very, very high. So he has a very important mechanism behind my trajectory. Yeah, I estimate around 98%. And that's it. Muito obrigado, everyone.
Pedro, vai sair daqui, né? So after this very didactic presentation, let me and call Eli Leibovitz as our first examiner. Eli, please.
Thank you. Yeah, okay. Thank you very much, and really big congratulations to you, Pedro, on this very impressive work that you've done. It's really been a pleasure kind of seeing you and your commitment to put out your hands and grasp as much of this field and area of research as you can. I think the work that you're describing here today is already very impactful is already really impactful work for our field. And I also want to congratulate you on your presentation. Truly an excellent presentation, being able to describe so clearly both the conceptual constructs. One of the best descriptions that I've heard of the interpersonal aspect and systems involved in child anxiety, but also being able to describe some of the black magic that goes into doing 10,000 bootstraps with 50 perturbations, and those are not easy things to describe. And I think you did a truly outstanding job. But what really stands out to me is that these are not just fancy statistical calculations. Right? You can do a lot of very fancy statistics if you're able to write software and manipulate data. But the questions that you chose to apply those tools to, the question that you choose to focus on, really are so directly relevant to the lived experience of children, of families, and of parents, right? Like just that frustrating daily lived experience of being a parent and working so hard to help your child, putting so much energy and bending over backward to try to help your child through their difficulty and their challenges or vulnerabilities, and just seeing them get worse and struggle more. When you bring that kind of analysis to bear on that, and it validates that experience and starts to give a coherent meaning to it, I think that's not just fancy statistics. It's really important work. Likewise, the focus on impairment as opposed to pure symptom severity counting, I think, is a really important focus. Right? Very often we do focus more on, right, how many symptoms, what is the severity, and that ultimately may be less important for a lot of kids' lives than are you able to sleep at night and get up in the day and go to school and interact with your friends and get along with your family. And so I think that's very important. And finally, that network analysis, again, another example of some very sophisticated, very advanced kind of statistical methodologies, but very tightly linked to some very core constructs of real importance. For example, showing the relative importance of the parent's actual behavior, like the accommodation, relative to a trait like the parent's own anxiety, to me seems really important, especially given that parent accommodation may be something they can choose to modify a lot more than what is their own kind of trait anxiety level that could be a little bit more out of reach. So I'm very impressed with it. I think you've done amazing work. If I were to ask you to maybe just reflect or comment, one of the limitations that you noted for this research was the relative homogeneity of the samples. And I think that's it's true to acknowledge that, but it's also true that you bring the advantage of actually having familiarity with a broader range of cultural, ethnic, racial, demographic populations. And so I'm actually curious if you just have any thoughts on the generalizability beyond, like, okay, we're acknowledging the limitation of the research, but what are your thoughts on the generalizability or the potential differences when you think about, some of the broader range of populations that you've had the opportunity to interact and work with?
Can you hear me?
Yes.
Oh, that's great. Thank you so much, Ellie, for your comments. They mean so much to me and our time together over there at Yale, and also the time that you briefly were here with us. Those were unforgettable times, and I also learned a lot during this experience. And so thank you for the question. I think that what when you were speaking and what I was thinking is that, yeah, these analyses, they do make a lot of sense to me. They are just not only like statistical trickery that we are trying to justify or tweak just to have a story to publish. I mean, they do make sense with the things that we see in real life with the patients in our clinics. I guess that the hard part is the slide where I showed the difference between study 1 and study 2, study 1 being confirmatory and study 2 being exploratory. I'm having a much harder time publishing study 2 than study 1. So even though it makes sense, yeah, we have had long waiting times, and yeah, it's going to be almost 2 years now. We got our review from Eric Storch journal, child anxiety, what is it called? Child development and child
psychiatry and human development.
Yeah. I got blank here now, but yeah. So now we finally got a chance to, because we got commentaries from the reviewers, and they always emphasize those points. This is cross-sectional. This is very exploratory. How can this defend? The other one is confirmatory. We are testing a hypothesis. There is a clear hypothesis, and yeah. When we have that, it is so much easier. Yeah, we have a hypothesis, we test the hypothesis, and we show that. But when we have a network, and it is a field that we are still, we know a lot, but there's also a lot to know. Yeah, exploratory studies and being cross-sectional, wow, yeah, that's a hard, you're going to have a hard time. So yeah, that is something that also for the future we can expand on that, on the sample, on the time points. We can use longitudinal data, but I guess that what your question is that from my experience, from what I see here in the Brazilian population, it also makes a lot of sense. It makes a lot of sense that within this network also family accommodation is having an important role. And as you said, this is a very nice message, because sometimes parents are, banging their heads trying to change their traits or their natural response, as we were seeing in the intro, the beginning of the intro. But actually, when they have this perception that they can change their behavior, even though their traits are not already there yet, yeah, for me, it makes a lot of clinical sense, and I wish for the future that we can maybe have more methodological strength, so we can reinforce this thing that we are seeing in our clinics, in our clinical practice. I guess that's it.
Thank you. How much? I don't know how much time I'm supposed to be. I'm supposed
oh yeah, you
have.
I think they have. Oh yeah, so 20 minutes each. Oh, 20 minutes each. So. Okay. Yeah. So I don't know how much we still have left, but you can. Yeah.
I can pass on the baton if we are out of time, or I can ask more. But I don't want to. Maybe I'll just ask you. Maybe I'll just ask you to kind of briefly think, because you were touching on the like additional methodologies that you'd like to see. I'm curious if you do have any specific thoughts about some possible next steps, maybe moving from the cross-sectional data into something more longitudinal, whether it is, you mentioned in your talk that these were data taken from before treatment. I wonder whether you have thoughts about what this might look like in the context of treatment, or whether it's bringing other forms of methods, like more direct observation or any kind of more ecological assessment or I'm just curious, what would you see as some really valuable next steps in taking this further?
Yeah. So yeah, for these types of analysis that I showed in study 2, and also for study 1, for study 2 there was a boom of cross-sectional network analysis in like 4 or 5 years ago, and now the field has realized that this is not enough, and we have now more advanced methods that incorporate longitudinal assessments, and also these comparisons that I showed, they have advanced to compare time points. So we could compare the networks, and this is something that I had in mind and I find interesting, Ellie, to check how would the networks change before and after treatment. Would maybe, now that family accommodation has lessened, would we see relation with other child dimensions? Would it be closer together? Would family accommodation be more central now, or less, now that it is not so important, maybe that the parents are showing lower levels? I am very interested in that. So comparing networks and seeing how we could have a more naturalistic, like if we had time points before treatment, good. But I think that with treatment, it would also be very interesting, because we have manipulated a specific target. So that is for sure one of the following steps and one of the things that we could do.
To which I say, let's do it. Let's.
Yeah, I know that. Yeah, I really hope to just and I'm believing it, and Luis is backing me up with this, that we are finally going to have this cross-sectional one done, and then we'll have now more weaponry to say, yeah, now this is robust enough, and this is what we see. I think that we are just seeing the things that we see in clinical practice, and maybe just reinforcing the importance, because I think that like the most important work was the one that you did, like the actual clinical trial. But now we are just reinforcing this message of how important it is to look at family accommodation, not being stuck only in, yeah, you have to change your anxiety. Yeah, let's think about the behaviors that happen in this interpersonal context. So yeah, I guess that's it.
Well, thank you very, very much. Congratulations again. I'm going to pass to the next person, but really big congratulations to you.
But Eli, just not to be unfair, you have a little more time if you want. Do you have any other point you want to make?
I think I'm okay with
So,
moving on.
Thanks a lot, Eli. I
Thank you.
appreciate it. And also remind that Eli received Pedro at Yale the first time and provide the database for the study. So we are in depth with you, Eli. Thanks a lot.
Thank you.
So now, Fernando Asbar. Yes, please come here, Fernando. Maybe here.
Is it working?
Hello? Okay. Can you hear me there? Okay.
Are you able to hear Fernando, Eli, and Jim?
Okay, I'm sorry?
We can't see you, but we can hear you.
Oh, they can't see you.
Yeah, maybe, do you think I...
Just a minute, please.
Você consegue virar aqui, né? Quer que eu vá? Quer que eu vá lá? Melhor eu ficar ali. Tá bom. Não, eu vou lá. Na boa. Okay, hello there. Nice to see you, Jim and Ellie, again. I have the privilege to have met a couple of times and interacting with them some here in Brazil. Many occasions that Jim came to Brazil and interacted with us, and Ellie the last time he was here a couple of years ago. I think it was just before the pandemic, or just after, I can't remember that. Anyway, first of all, thank you for inviting me to. It is a privilege to share this occasion with two eminent figures, and I thank you, Pedro, for the invitation. Thank you, Professor Eurípedes, for the invitation as well. And I try to. I made some notes here, and then so I have my papers. I'll try to go through the text that you sent to us, but before any comment, I'd like to say that I really enjoyed your presentation. It helped me a lot to better understand all the technical, statistical issues that was quite difficult for me to follow. And as Ali said, that if you stick to this part, especially being a clinician and not used to all the statistical information and the language, so it was quite difficult in the first time that I read, but it was much easier after your presentation. So it's very nice presented here, and this is the main point that I would like to stress, and I'll leave it for my final comments and how following the same path that Eli just had now, thinking about what you're going to do with this information in the future. But I'll go through some other things here. Beginning with the abstract was very clear, and the first words that you wrote, and I like to stress this. I felt you were very brave to reveal a lot of personal things when you wrote there. So, and I liked that, and it was. I like to read what you wrote and express yourself and reveal some of personal things. It's not common to have that, and I want to stress that in my comments. As in your class, in your presentation here, the introduction was quite clear, and when you explain about anxiety, the difference between anxiety and fear, or the importance of anticipation and something that is lived beforehand. So it is so important in clinical practice, this, when you do the psychoeducational part of it and explain to the kid or explain to the parents. I don't think I will go through all the results that you described so well, and maybe I'll ask you some things, and then you answer, and we do like that instead of doing all the things. And the first thing that you had to you had to study 1 and study 2, the population, 420 something, and were they the same subjects for most of the time?
Oh yeah, they were the same. We just had 8 more subjects, and
For study 2, right?
For study 2, and the important thing here is that they are doubled. So these are pairs. So we have the reports for the children and for the parents. So yeah, it was 425 for study 1 and 433 for study 2.
Okay, and then that's when you entered the study and you started to do this kind of thing, this analysis,
Yeah,
right?
exactly. So I know that Ellie has more data now, but for since we got I started these studies, this was the sample that we had.
All right. Okay. And I'll go straight to what I think was the most important things, and in my opinion, as a clinician, and how to translate all this data into clinical practice or clinical difficulties that we have when we treat. For instance, how to use all this important information that you have brought into situations like quite small child who I'm thinking about the CBT treatment and how to include the family accommodation or the family participation in the CBT treatment. And I think that's the most important thing. I'm thinking about when the child refuses to treat or to expose him or herself, and the family they don't know what to do, and the CBT treatment, the outcome is unsatisfactory. So how to deal with that, and then if you have the family accommodation, how to manage that. What I'm saying is that sometimes it is impossible to have the kid exposing him or herself, and so the treatment doesn't work. And how to use this information or use the presence and thinking about family accommodation or the family participation to stress this when the kid doesn't want to treat or doesn't refuses to treat. So that's I'm thinking about the future plans for you. So I'd like you to comment on this a little bit.
Sure. Thank you for the comments, Fernando, and thank you for accepting to be here. And I'll just try to speak a little louder. So now with this topic of how to deal with these difficult cases, I think that when I tried to prepare this presentation, I was thinking of not only Eli and Jim and you, Fernando, and Eurí listening to it, but also my family or some of the lay people that are here. And I remember reading the first time when I was reading mediation studies and network studies, and it was so hard to understand what was written there. And I mean, the terms are used as they are common language, right? But they only start to become common after months and years of being exposed to it. So I guess that when we do a study, we are thinking of what other researchers are going to read and how they are going to expand and replicate the data. But what I found actually that that message of study 1 of the impairment associated with family accommodation to be a good point of discussion with the parents. I mean, if you explain to them what impairment is, and we are not so worried, we are worried about symptoms, but our main target is for the child to be able to do things, to be free from their condition. I mean, to have the freedom to do stuff. And I think that it helps actually in clinical practice, just to show this image. I sometimes pick up that slide just to show that actually our main focus and our main outcome is functionality. And we know now that this is not the only mechanism, but it is one of the mechanisms, and it is a pretty significant one. It is one of the cogwheels, family accommodation. So if we don't need the exposure and of the children, because we are talking about family accommodation as their own. Yeah, I have that in bold, and I learned this from Ellie actually, but yeah, the focus on the parents' own behavior. It is so easy for them to when they start to think about family accommodation, they still target the child. So, oh, now I understand. Yeah. So now I won't allow my child to go after me. We are not thinking about the child behavior. I mean, separation anxiety. They will probably follow you still, but what can you do? Will you keep the door open, or will you close the door? Communicating always. Yeah, this doesn't mean not being supportive, but yeah, I believe in you, and I know this is best for you. I am contributing to your impairment, and I don't want to do that anymore. So I am going to my room and I'm closing the door. And the child will become distressed, but they have learned, the parent has explained to them, and they need to keep that. And also another slide that is important is the one on the short-term relief, because it does bring, when you accommodate, it does bring short-term relief for the child and the parent. And however, we are thinking about what else, what comes after the short term, and how impaired your child is going to be. So I think that sometimes just looking at those items and thinking, wow, what does my child is not doing because of their anxiety, and what may I be doing? And this helps a lot, because yes, many times, especially with small children, we don't have their cooperation. They are not the ones that came looking for us. They are not the ones that, hey, Dad, Mom, can you take me to a psychiatrist or a psychologist? They were taken there, and we are trying to change things, and it seems to be working out in the short term for them, just like what the parents are doing. So I think that sometimes that this study may be more impactful for the message that for the parents than maybe for the researchers, because one thing is for them to know, and the most important message is Ellie's trial. Yeah, if we target family accommodation, it will be efficacious. But sometimes just to have a glimpse of between a fifth and a half of what your child is impaired, it has to do with your own behaviors and not only what they are feeling. So wow, yeah, now this is important. So yeah, I do have to bring my child to the psychiatrist or the psychologist, but I also have to bring myself and my thoughts and my behaviors. So I guess that this is one, and being the study one is much more straightforward and simple. So it is simpler to show this message to parents, to families. But also, if you want to expand and think of, wow, this is the child anxiety, and where does parental anxiety and family accommodation? Because sometimes I feel from my clinical experience that, yeah, I brought my child to treat their anxiety, and now I have also this burden to reduce my anxiety, and which is sometimes so automatic, and yeah, now you have to change your anxiety, how you dealt with things your entire life, and because you are the one making your child more anxious. So if we also show that network, okay, this is related. I think that I didn't stress, it wasn't on the highlights, but a finding of the network was that all variables, they were positively related. So when you see a network, they are not always blue like mine. Many times they have red in it, and red is negative correlations. And there were none. So we are in fact talking about variables that are all related to each other. Parental anxiety, child anxiety, family accommodation. But if family accommodation it has a bridge function, and it may be a better target because it is more focused, more specific, and we have goals. Like I mentioned, the one of the closing the door, or maybe not sleeping through the whole night with your child, or maybe not reviewing parents can start by just reviewing it one time less. The example of the generalized anxiety child that was worried about the homework all the time. And yeah, and maybe you can think of, okay, so now I'm going to work on my family accommodation, and I have to change from 80 to 0. No, yeah, we can do that in steps, so the child can learn that this is a process. I'm working on it, and yeah, and parents can also do not need to feel overwhelmed, and yeah, it doesn't have to be this message. I guess I talked too much.
No, allow me to say some of the things on what you're saying. We're thinking about family accommodation, but if we let's suppose that there's no family accommodation, but before that there is family participation. And then if you get stuck to all those CBT manuals, you have those parental sessions, as you showed here. You have general information or general situations, which is it's very important. But in clinical practice, sometimes a kid is referred to me, and is doing psychotherapy, not necessarily CBT, but and I asked the parents, did the therapist call you for orientation from time to time? Oh, hardly ever.
Right. Yeah.
So that I mean, and then I'm thinking about the importance of your study and of family accommodation, or even family participation, and how to stress this in the treatment. I mean, sometimes it's the only tool you have, because the kid doesn't want to do any of the things that should be done to decrease the anxiety. Yeah. And then that's the only tool you have to work with the family. So, I mean, this is more important than
Yeah, this is the message for the clinicians also that you are saying. It is, we cannot think. It is the very beginning of the presentation. We cannot think of child anxiety without thinking that it is an interpersonal phenomenon.
Yeah.
And sometimes it is easier just, yeah, for the child, sometimes it is very easy to pretend that they are receiving treatment, and then the parents can pretend that their child is getting treatment, and the therapist can pretend that he is applying the treatment.
Yeah.
And yeah, nothing is happening, and nobody is talking to each other because it involves effort and time. And yeah, sometimes that happens. And yeah, I guess that the very beginning of the presentation deals with that. I mean, it is an interpersonal phenomenon. You cannot think of it as only, yeah, I won't know what is happening for the parents. And about the first thing you say, sometimes we don't have high accommodation. Yeah.
Yeah.
Accommodation is something that I also talked with Eli a long time ago about this. And family accommodation actually appears to be universal in all cases. Sometimes, like if you see, I mentioned this statistic, like somewhere between 95%. Some studies say 100%, some 90%. I think that the ones that say 90, the parents are not being so truthful, because I mean, we are not talking about high family accommodation. That doesn't happen every time, for sure. But some degree is expected, is natural, and they don't have to feel that this natural response is also something that, oh wow, I accommodate, I'm being evil. Yeah, it is kind of in the root of this interpersonal phenomenon, as I see, at least, and from what I have read and known. But so I mean, almost all cases it happens, and we have to worry when it happens in excess. It is that slide with the thing on the top left. If it is happening in excess chronically, so I guess that the two take-home messages from your comment that I agree 100% with Fernando is that, yeah, parents need to be involved. It is needed, whether family accommodation is high or just in standard levels. And family accommodation is something that usually does happen. We just need to check if it is being excessive or not. And sometimes just for the parents to be aware is something useful, because then they can think of their behavior and think of encouraging and supporting their child. Like, oh wow, I was doing that for you. I know you can do it. You have it in you. You are capable of dealing with it. The thing is, I was doing that for you, and I'm willing to change through some steps.
Yeah. Just to add and finish my comments here, in our service here, it's quite common for the kid to use the medication, gets better, but then if you have all this scenery of family accommodation, and so the treatment stops and doesn't go any further. The outcome is poor. So that's the main point, and I see a quite important thing here, and thinking about future steps of the results that you all have. Well, anyway, congrats. It's a quite nice work and very hard work that you've done.
Thank you.
Congrats.
Thank you so much.
Thank you.
Thanks a lot, Fernando. And now I would like to call Jim Lackman. Jim, I think the two of us has a have a reason to celebrate today because for more than 30 years we have been working together in our exchange, Yale exchange program. And Pedro, this whole thesis, the whole work of Pedro's, the whole Pedro's works is a result of the third-year residence training that he has with Eli. So if I could say, Eli, you are the co-supervisor of this thesis, or maybe I am the co-supervisor, you is the advisor or the supervisor of this thesis, and Jim, I would call the teacher of all of us. So I'm seeing that you also agree, Eli. He he's not only on the top child psychiatrist in the world, but also has been inspiring all of us, and I would consider one of my main mentors. So thank you very much, Jim.
Well, I would just have to say obrigado. It's such a pleasure and honor to be part of this process, but I wish I was there in person. And it's tragic that I'm not there at this particular moment, but thank you so much, Pedro. You have certainly shown great effort and dedication in terms of the work that you've done in preparing this thesis, which is excellent and superb. And certainly your presentation today was well structured and presented clearly. And I'm very grateful for the work that you've put into developing this initiative. And I'm really looking forward to the future. And there may be a follow-up study that would involve a similar population, and it may be also having that offered here at Yale, but also I'm really curious about what the realities are there in Brazil in terms of the opportunities that you might have to actually not only do an initial study, but also a longitudinal study where you're looking at the long-term outcomes of individuals and families. The other interesting issue, of course, that comes to mind when I hear your presentation and read over the article that has already been published, and congratulations that the second article is going to be published before too long, is that the information that we have, and it's quite appropriate that we'd be focusing on what the mother's perspective is, but I'm also curious in terms of the role that the father may play. And I think in looking forward to the future in terms of future studies, it would be interesting. Although certainly the mothers makes a great deal of sense that the focus would be primarily on them. But I'm curious about what role the father may play. And of course, it may vary from family to family a great deal. But their perspective, I think, would be another one that would be worthwhile taking a closer look at. But I think that I'm really impressed by the way in which you've responded to all of the comments and questions that have been asked by the other members of the committee. And as far as I'm concerned, it's my opinion that we can go ahead and, as a committee, make a decision that you have indeed passed for your doctorate. So congratulations. And we're very honored to sort of see you in action and looking forward to what the future holds for you. But I guess I'm curious in terms of developing a program there in São Paulo, in terms of what the opportunities might be in terms of looking at a longitudinal study there, and also what your thoughts are about engaging the fathers more.
Thank you so much, Jim. And yeah, I echo what Eury said. If it weren't for you, actually, probably this program of Yale USP connection wouldn't exist. And my connection with Ellie certainly wouldn't exist. Because, I remember this is so vivid in my memory, how this guy, who is one of the most eminent psychiatrists in the world, and in psychiatry history actually, would have this moment for us every week and just listen and not be checking on the clock and hear what do you want to do, what are you interested in, tell me about what you are doing now and what you want to do next week, and who do you want to meet. And in one of the first meetings, I thought of Eli, who is this guy that I had heard of, but never thought that I would meet in person. And I remember reading this study, and it was, I used to check regularly Medscape, this app, and I got this notification. I remember clearly the day that I read that you can treat child anxiety without even seeing the child, just by focusing on the parents and reducing family accommodation. And I was struck by this, and I read Eli's study, and wow, I really want to get to know this more and read this more, and I wouldn't even think that it was going to be possible to meet. And I knew that in the third year we would have this exchange program, and I read that Eli was at Yale, so it was maybe, and I wouldn't think that maybe you two guys would know each other. And Eli told me, I remember Eli telling me how you were also very, very, very important in his trajectory, how you received him and was careful towards him, very caring. And yeah, so I heard this story many times from Eurí, and I never get tired of listening to it, how he met you and how important it was in his trajectory. And when he was an exchange student and met you. So yeah, you have been doing that your whole life and keeps doing it. So thank you so much, Jim. Really. And okay, so the thing about fathers, that is a very interesting thing, because the way I understand, we are kind of used to the American culture by the series, I mean, and all the media. Sometimes I hear more English than Portuguese when I'm hearing podcasts and reading studies, and but this is our culture. And when I was there, and in the 2 times that I had the opportunity to spend some time in the U.S., it is not our culture, and there are clear differences. And here, yeah, I mean, if a child comes to the clinic with the father, that's something weird. Usually here, I mean, usually it's always the mother. They are the ones that bring their child. I guess that in the U.S. the majority is also the mother. I guess that is something kind of biological and cross-cultural. But here, I guess that I see our culture as also a very matriarchal culture, in that sense, that the mother is the one that cares for the family and is the one that is dealing with these things. But yeah, and I guess that fathers, they get a free pass. That is not fair. I mean, they are involved. They do accommodate and they do participate in that network. But sometimes, yeah, it is something that you have to say, like, oh, okay, bring the father, make him. Oh, but he works. He cannot come. Yeah, you have to find a time and a place And usually you have less frequent encounters with the father. At least here, I have less frequent encounters usually with fathers than mothers, and that is a problem. So I guess that this point that you brought up is a very, very, very significant one, Jim, that this data was focused on mothers, and fathers are involved in this network, they are involved in this phenomena, and how would that be different? What are the things that we need to say? How do we need to approach them? I guess that we know many of these answers, and maybe it is not so different than for the mothers, but it is a different relation that fathers establish in the family, and they are involved. So I guess, yeah, I wanted to have this picture. It is one that I'm missing for me to show the families, like how the father is important and how he's contributing to the network, and to show, yeah, you need to come. You don't get a free pass. Like, yeah, you deal with it. My child and the mother of my children, they deal with this. So yeah, this is an important topic, and yeah, we do have some opportunities to look into this over here. When I started getting interested in that before going to Yale, I checked if we had any measures of family accommodation in our high-risk cohort here that you are very, very familiar with, Jim. And we don't, but we do have some indirect measures from family questionnaires, and maybe we'll have to, I don't know, think of that and maybe open an arm of that, because I think that those are major points that you brought. I want to have a culturally replicate this in a different culture, and with longitudinal data, and some way of also maybe comparing. So yeah, I guess that from today we got some 3 major points: comparing before and after treatment, comparing how it may change with being the mother or the father, and between different cultures as well. So yeah, thank you so much for the points.
Obrigado, and congratulations.
Thanks, Jim.
So thanks again, Jim, Eli, and Fernando. Now is my turn to say a few words, and I'd like to start saying that it was a big privilege for me to work with you, Pedro, throughout all these years. During this period, I also was impressed with several of your abilities, particularly how easy you can learn different disciplines, particularly how much you could learn about statistics during this period. Sometimes I have to talk to Pedro. Pedro, come. This is a thesis about psychiatry, so come down. This is not a statistic, but I was impressive in your ability to learn a new area so different, and at the same time so deeply. I was also deeply impressed with your capacity to stay organized and prepare presentations like that. This is incredible. It's remarkable. And also, reading your acknowledgments, see how many people you were able to bring together to help you, to support you. And this tells a little bit about your ability of create credibility, ability to be able to do what you set out to be done, and this is very important for a researcher, because collaboration is the main ingredient of any research. And I think you during this period you were able to bring together a lot of people and inspire trust in all of them. So congratulations for that as well. Also, I am impressed with your ability to change yourself, to push beyond your own limitations. Today, I can say that Pedro, probably Cristina and Paulo would agree with me that Pedro is just a little bit anxious, just a little bit, right? and today I understood the concept of interpersonal, this interpersonal thing you mentioned here, that probably move parents to accommodate with their child's anxiety. So today I identify myself a little bit. I understand what's that, because I was anxious about how Pedro would deal with his anxiety here. And I realized that I was more anxious than you. So today you also show how to overcome limitations. And probably I would identify myself more with Cristina, because you said the parents, Paulo, are not really involved in this kind of worries, right? Are the mothers who, at least in our culture, probably feel more anxious with the anxiety of their children, right? So I'm still a little anxious, but I'm so happy that you performed so well and were able to really present a model of presentation. I think I was happy that we had some students here today, and I hope several of them could see this presentation in the YouTube. But the didactics and your preoccupation of communicate well your data was impressive. And I'm also talking about going beyond your own limitations. I'm also happy that you are doing your channel in the media channel, right? I still taking that project along.
Not super strong. I wanted, I guess that I started stronger because I wanted to challenge myself. After I did my first video, it was about anxiety. After that, I'm not super strong. I have only that one video, but yeah, maybe I'll go, and I like communicating. It is a challenge for me, but when I'm able to do it, when I feel that I can present clearly some sort of idea.
But if it was a strategy to improve your communication abilities, just one was enough to put you in another level. So congratulations. And beyond these academic and professional achievements, what I think really sets you apart is your character and your loving nature, generosity, that probably makes you so precious. And in this regard, I have to give the credit to Paulo, Cristina, and in his most recent version, to Nachi. I can see how much you have influenced him in a positive way. So congratulations for you, Pedro, and thanks you and for your whole family, and thanks you for being here today. And now I will talk with the examiners to give the grades. Pedro, do you know if I have another link, or I'll have to ask everybody to leave the room? Probably.
Oh, I have no idea. Maybe I have to check with Isabel. Can I?
So if you guys don't.
Yeah, for sure.
Maybe if you guys don't mind, maybe everybody. Fernando. Vamos ficar aqui nós. A gente fica aqui. Vocês podem ser um minutinho, só 5 minutos, a gente precisa mudar o. So Jim and Eli, Fernando and I will be here with you guys just for us to talk about the grades. Fernando, você pode escrever para mim? Você está com as coisas aqui? Pode escrever para mim? E daí eu vou falar em inglês para eles. So Jim and Eli, usually we give just an overall comment talking about the presentation, how good was the presentation, how the student was able to respond to the questions raised based on his data, and then so this is about the student, and then about the thesis, if the thesis includes clear questions, research questions, adequate methods to test those research questions. The data is discussed considering the literature in the area, and the conclusions are adequate. So this is what we have to write. That's okay? So would you like to make any comment before, you two?
Well, it's just a pleasure and honor to be part of the team. And I would have to say that he has certainly shown great effort and dedication to this project. And moving forward, I'm sure that there